Now 3:30, I'd like to call the Ways and Means Committee meeting of September 6th to order. Roll call, please.
Commissioner Collins?
Is excused.
Commissioner Cross?
Here.
Commissioner Jarosinski?
Here.
Commissioner Engel?
Here.
Commissioner Decker?
Here.
Commissioner Longmire?
Present.
Commissioner Maloney?
Here.
Commissioner Plummer?
Here.
Commissioner Sullivan?
Excused.
Commissioner Snyder?
Here.
Commissioner Wilkins?
Here.
Thank you. Next item on the agenda is approval of minutes, August 21st, 2012.
So moved.
Motion's been made and seconded. Is there any questions or corrections? Seeing none, all in favor say yes.
Yes.
Opposed say no. Motion carries. Next item on the agenda is public comment on an agenda item. Is there anybody in the audience that would like to comment on an agenda item? Seeing none, next item. Oh, excuse me. It's on it. Deb, you'll be on the last one.
If I may, I'm kind of familiar with what Deb's going to say, and I think her comment wants to come during the public hearing on the budget, because it involves cuts, if I'm correct.
Whenever you want me to talk, I'm fine.
But
We'll let you eventually.
But I think it's during the public hearing portion of this, okay?
That's fine.
Okay, next item for consideration, WM 12/09-1. Oh, I'm sorry, I passed up. You confused me, Jim. Next item is public hearing. 2013.
Public hearing. Second.
Thank you very much. The moving second, I open the public hearing. Public hearing is now open. Now
I can talk. Okay.
Sorry.
That's all right. I'm flexible, Jim. No problem. Okay. My name is Deb Schultz. I live in Muskegon County and have all my life, and I teach at Grand Rapids Community College. I teach dental hygiene, and particularly dental public health, among other things. But I would like to address the commission today on behalf of the dental programs in Muskegon County at the Health Department. If you remember, some of you were probably on the board back in 1999 when we approved a dental health coordinator position. Based on a lot of the problems that we saw in Muskegon County and the needs assessment that was done, there was a problem with, and among other things, dental childhood caries with children right here, close in town and all throughout our county and actually throughout the country with baby bottle tooth decay. And so in order to address that issue, I have some pictures that I'll actually show you that were taken back then. Well, this problem has been addressed and we've reduced it significantly, but it's still an issue. And I would really like to be available if anybody has any questions regarding what we can do as far as dental public health in the area of prevention. As a dental hygienist, I've been teaching for 24 years in Grand Rapids, and the students have to have 3 years of education in relating to health education as well as dental education, and there's more and more evidence that prevention is the way to go. Doesn't only prevent childhood caries, it can prevent early delivery, premature birth of babies. It can help reduce the severity of diabetes and heart disease, and that's among some of the many other research things that have been proven that dental health is really essential. And prevention is a heck of a lot more inexpensive, tenfold plus, rather than treatment. And some of those pictures that you're seeing, the babies actually have to go into the hospital under general anesthesia, and this could be prevented. And so I've given you some information, and I apologize for the way that it looks. This kind of took me off guard. Classes are starting. I teach full-time in Grand Rapids and live here, and so I just had to add more things on the end of it, so I wanted to make sure that you got it. And so things are listed, also the nursing home program that we'd like to get started. So if this goes away, that position goes away, so does any dental health. that's going to, promotion that's going to happen as far as from the Public Health Department. And so I'd really like you to consider that. And consider please also, if health education in Muskegon County wants to get ramped up a little bit, a dental hygienist could perform health education as well as coordinate a dental health program. But simply a health educator cannot present dental health information in the way that it should be. Also, I understand budget constraints and things like that, but there's a lot of grants out there nationally and through the state that can help to supplement this program. They just need some direction to be able to have people find those grants. And Jackie's been the person that's in that position now, taking grant writing classes in an effort to try to increase that. Also, for the last 13 years since Jackie's been in that position, I have taken part with Jackie and partnered with her and bring the dental hygiene students over to Muskegon County to do, we've done several things to help with that. And I'm very familiar with this situation because back in the early 80s, I was the dental health coordinator for Muskegon and Oceana County for Head Start. And literally, if you can envision this, there were pictures in the paper. I'd wear my fairy suit and I'd be going from Head Start Center to Head Start Center trying to help promote dental health for parents, teachers, and the kids. And I love that, and that passion's always been there, and I convey that to my students. So if you have any questions, you've got my email address, and I'd be more than happy.
If I may, her concern is that in our budget, that this is one of our steps in adopting our operating budget, that there would be some cuts in this area. And I'm not specifically sure what those are, but I surely, if this is Mr. Heath, if you could get us how that might be affected, because that's your concern.
That's my concern, that the entire position would be cut. And I could see that it being changed into something a little bit different to include health education component possibly in addition to dental health. But it would have to be like a hygienist that would take that position over.
Last year, I think we made a major cut in this too. Is one of our hospitals or something was supposed to be taking a lot of this over? Have they been doing that?
Well, they've been working on developing a plan, but Jackie and I have been working to try to develop this for years, and I don't even know where that's at. As far as trying to meet the emergency care needs of the community, and that would be more of the adult issues.
Yeah.
Hackley Hospital, on the other hand, with Dr. Rafferty, and that's some of the stuff that's on here, over the years has seen some children. But Jackie's made strides, and a lot of those things are listed, and you can go onto the website, and I'm sure you guys have received reports on that. She did a 10-year report, and then she has done annual reports on accomplishments. But Dr. Rafferty used to see all the children that needed to be put under general anesthesia to treat their care. I'm not sure where that whole thing is at right now with those treatments. I know the pedodontists in town do not see Medicaid patients, and a lot of these kids are Healthy Kids dental patients, which is Delta Dental now, so they should be taking them, but I'm not sure if they even see them. Okay, so we want to prevent it. I mean, you can imagine being able to prevent, put on cavity varnish, fluoride varnish for these children, and to prevent these caries and cavities, rather than have them have to go under general anesthesia, thousands and thousands of dollars, to treat these children. That can be prevented to some degree. Okay, not 100%, of course, but we try really hard. And if we can get those kids and those parents, as somebody that's done this, while they're little in Head Start, getting used to brushing, talk to the parents, teach the teachers, then it's hard to say how many kids can be touched, but I'd hate to overlook that.
Does anybody else have any questions? Thank you very much.
You're welcome. Thank you.
Is there anyone else who would like to come forward for the? Anyone else comment on our budget?
If I may, I hope someone from staff, I know Bonnie is gone, Mary, could respond what's going on in this present budget to her concerns.
Actually, I'd be happy to turn it over to Mary Jo.
It's an odd situation with Bonnie, so, but.
I understand. Yeah, I'll plan on giving a presentation, if that's okay with the chairman. To give you guys I know for a lot of you have already seen this presentation, but however, the state statute indicates a public hearing to disclose as many details as we can in the public budgeting process we have in Muskegon County for the fiscal year 13. And that's the purpose of this presentation. So if there is anything that I glossed over that needs any specific detail on, I would be happy to provide that. And so without any further ado, I'll move it along. In case you're not familiar with the county's budgeting process, we have moved over to a different planning model that we had from previous fiscal years. The first year was the 12 planning process, to which we have moved alike departments into functional budget teams. And these teams are, as you can see, is listed on the screen. They meet and they confer with one another, and they try to find ways, unique ways, to meet objectives for the county instead of doing the old historic 5% across the board cuts. Those are very destructive. We don't feel they're fair, and this model provides more equity across the board in regards to the county's core functions. And if you're not familiar with what the county's core functions are, those core functions are, one, listed on the county website, but two, what they are is we have put together in a matrix of functions, so which ones are mandatory, which ones are discretionary, and everything in between. And so with that, we take into consideration the teams of like teams by function, but also which teams have more discretionary versus mandated core services. And those departments that have more mandated services obviously have less of a burden as to cuts, as to a percentage of cut, than the ones that have discretionary cuts. So that's how we've approached it here in Muskegon County, to make sure it's more fair, it's more equitable. And it also encourages an environment in which we are constantly talking with between departments with one another to find ways to either consolidate or to gain on the economies of scale with one another, and etc. So with that model, and again, this is the second fiscal year which we've done it, we were given a target, $1.8 million of reductions. Either through, I guess let me retract that. It's not necessarily $1.8 million in reductions. It either is reductions or revenue enhancements. And so with that, you can see from the table that we have exceeded those expectations for the second straight year. And that's good news. It tells you that, one, the model, I think, is really taken a hold. And I think it's being well received within the different departments. So with that, you see that, again, not siloing these efforts as to who did what. It shows you as a team, we accomplished the goal, and not only accomplished it, we exceeded it. And so I'm very proud of that. I'm very proud of the team, and my hat is off to them for pulling it together yet again and for another fiscal year. And giving you some highlights just on each of these teams. One, the general government highlights as you see on the board. There's some reorganization that's going on, enhancements, of course, and again, without reading every line of death by PowerPoint, you see the things that have been done that have met this particular team's goal. Public safety, again, some of the same things. Again, we're always looking for those ways to refine our processes. Do we have to replace positions? What can we do differently with them? Can we do it this way instead of the past way? We're always pushing ourselves to look at those alternatives. Again, the human services teams, a little differently. Again, you're seeing that reduction in that residential treatment and expenditures is our key focus for this team. They've done a very good job, and we are starting to already see those expenditure reductions. And again, that is a consolidated effort. That is not just one, again, department siloed by themselves. That is a team, and you know who they are. I mean, it's Family Circuit Court, that's the Juvenile Transition Center, that's That's Child Haven to some extent. Estate. Maybe there's just a lot of functions going on here. It's the accounting department, it's the budgeting team. We're all a part of this structure that looks at how we can better serve our public through our program, our programs in this case plural, and be able to provide, in this case, a better product with less expenditures. So we're seeing already through this juvenile intensive in-home treatment is already starting to pay off, and I'm very very hopeful for what I see here coming for the future is to getting this trend where the kids are being treated here locally within the community in which they live and where they're brought up and where their families are located, more importantly. So without further ado, move on to community services. The key here was it's some of the same things as reallocation of revenue enhancement, but here is reallocation of expenses. Here is, wait a minute, does it make sense that we are the only person that bears this expense? Is it possible that we can share this expense? And that's what you saw with this team, and that was very, very good to see those types of things because, again, it's status quo is not necessarily always the plan of always making sure that always stays in place. Here, status quo is always challenged from every fiscal year as to why do we have to do that? And this team environment, I think, is constantly evaluating that process and always challenging it. Now, moving on to the revenue side of the budget, more the same in some regard, not to be depressing, but however, some good things to talk about is unfortunately we're still in a little bit of a free fall on our property tax base values, and with that, and of course the county's making those necessary adjustments. Where we are hopeful is that residential values and of course everything else across the board, commercial, industrial, etc., start recovering. We were hopeful that this coming year 13 we'll start seeing that recovery. Signs are starting to be indicated not only at the state level but also within certain pockets of the state that the values are starting to recover. One thing I can tell you is the guarantee from this recession is that rate of recovery has been very slow and delayed. And so at this point, we don't know as to exactly when that might be. We hope it's 13. But again, if it's not, we will deal with it in the same manner in which we've dealt with it from this approach and the previous year's approach, in which we try to always keep the integrity of our programs in place to be able to serve our public at large. And with that, bless you. And with that, the one thing that I want to keep in mind is that the county, even though overall you're seeing this impact in that taxable value piece, we're trying, and actually, we're not only trying, but we have succeeded in bringing in alternative revenues to be able to supplement the gap. And that's the key. That's the premise of this approach is that forward thinking, to take a phrase from our county administrator, and it's an excellent phrase. It's exactly what this document does. It's always keeping your eye to the future as to what we can do to supplement that gap instead of always tax, or use tax, or use fee, or etc. What things can we offer to those regional items that's really wanted to where we can supplement the gap? But this kind of gives you kind of a quick spread of where we're seeing those reductions still yet. I mean, it's no surprise to see residential and everything else lagging, with the exception of agricultural. That's nice to see. One industry is not at a negative, but you're seeing that again, that we've got a little ways to go. But again, we're hopeful for a speedy as we can get recovery. To break down our revenues by source, for anyone who in the public that either one, you're interested, or two, just for their information, we categorize our different line items, and so what you see here is not necessarily what's within our line item budget, because if you had the line item budget, that's a very large document, but we categorize alike revenues into these categories that you see here on the board. And it shows you the spread of the general fund revenues only. And again, the purpose of the public hearing is not only one, disclose these revenues, one, but two, show you in the way we support this. And a large portion, as you see, that we support this is property taxes, and which that rate, which is here, the sole purpose of that rate is to supplement this fund, the general fund, which is the parent fund for generating those activities. So moving along is to the trending of these revenues. And again, what I have stated previously still stands, is our goal here is to change this past pattern, as you see consistently, where there's this very, very heavy dependence on property tax revenues, period. I think all of us can say, as citizens and as taxpayers, that we're all tired of taxing. What things can we do differently to offer services that are, one, wanted, but two, outside the paradigm of what we've done before, is what this budget document starts to do, is to supplement those different areas which we haven't tapped into in the past. So this paradigm we need to break. We haven't broken it since what, 1800s, which, you know, again, we can and we will. I am confident of that. We're already seeing areas in which in this document to where we are already thinking outside the box to what things can we offer again to the public. Or cooperation efforts with other municipalities to where we can consolidate things down to lessen that burden on the taxpayers. Revenue sharing, this is always near and dear to our heart, and it's been also near and dear to the state of Michigan's heart. As everyone knows from our current governor's approach, is he believes that the past practice has not been a model that has been successful, that his model that he's promoting is more competitive based, to push us as municipalities to look for best practices and to take whatever we can, best practices from the private sector and apply them where they are applicable. And again, that's a big piece that most people don't understand when it comes to the public sector, is there's some things we can try to apply, not all, because again, we are governed by a larger government regulations on a lot of different scales than there are in the private industry. And so here, as you can see, this program is taking what we've historically have always received from revenue share and is saying, okay, you're going to get your 2.2 million. However, the 555,000 of it, you're going to have to make sure that you meet 3 different categories to which, to our satisfaction, if you meet those categories, you'll receive the $555,322.99 and hold what we've received historically. Or if you don't do them, then that's what you will forego for revenue. This is annually, folks. This isn't just a one-time punch. This is an annual hit that would just be very detrimental to the county operation. So those 3 categories again. The accounting, the accounting and the financial transparency piece, which is the dashboard, which will be online on the county's website no later than October 1 of this year. In that dashboard, there's a lot of key indicators of status that they would like us to broadcast to our public as to things that are happening within Muskegon County. From 1, how we're spending the money, to 2, what types of what rates of crime are specifically, et cetera, moving on down. The other different categories that the state is having us focus on is also the employee compensation piece, which has gotten a lot of press as of late. And you know, there the county has been compliant with the state mandate in regards to example. This is where the health insurance piece came in, to where the employees pick up the applicable equivalent share that they were looking for, that 80-20 equivalent that they were looking for, which the county has accomplished through our negotiations, through our labor union agreements. So we took care of that piece. And the third piece is that consolidation, regionalization piece. And again, these each are different categories at different due dates, which the county will comply with. We've already put that part of the process. So we're already prepared to submit those in when they are due. Fund highlights, and again, to move through as quickly as I can to give you some detail of each. And again, this is not an exhaustive view over each fund, because if I did that, we have about roughly 80 plus funds. And I think for the sake of the audience that already looks bored out of their mind, I will not go through each and every one of those 80 funds. I promise you, I will just pick a very small cross-section of those funds to discuss. So again, Family Court Fund, revenue expenditures balanced. The appropriation, as you can see, that comes from the general fund. A lot of good things going on in Family Court. We're seeing now under the new leadership of Eric Stevens, we're seeing a lot of, again, forward thinking. What things can we do differently? Do we have to necessarily do things the way we've done them in the past? No. This department, along with others across the whole county, is constantly looking for ways to reorganize and reposition themselves to be in a position to offer the same level of services, but in, again, a different way. Public health, which was mentioned previously. Here's the, of course, the revenues and expenditures, maintenance effort piece, which again, the key piece is that maintenance effort must be met by state law. But keep in mind, though, that the maintenance effort that the county currently places in is above the minimum threshold. So I want to make sure that is clear. That we are not just meeting minimum standards in Muskegon County, we are actually exceeding them. And actually, if you look at a cross-section of counties throughout Michigan, we are right in the middle of the pack, for the most part, and actually a little more towards the top part of that middle part of the pack, but providing that percentage over in lieu of that minimum for maintenance effort for public health activities. So I'm very, very happy about that. Now, and of course, they have a small revenue reserve fund balance, but that's, again, I think in lieu of the fiscal year, whatever the snapshot where we're at this time next year, you're more likely not going to see that balance will be a lot closer to zero. It's just where a time where expenditures fall where they do within the fiscal year. You'll either inflate or deflate that reserve based on that level. So, and again, I think we'll be coming back probably to public health because I know there's questions on regards to that dental health program. We can either address them now, or I can move on, we can address them afterwards, whatever the preference of the committee is.
Yeah.
No, I think the question that was being raised is in regards to one of the position eliminations that's in the public health proposed budget is the dental, I think it's a dental assistant.
Dental health coordinator.
Thank you, dental health coordinator. I can only comment on the financial aspect of that component. In regards to the program level, I would have to defer that over to the public health department, which they are here in attendance, actually Kathy Moore, if I may defer that question to her, the Deputy Director of Public Health. I think that's better, well suited for her to answer versus myself.
Please do.
Kathy, sorry to put you on the spot.
That's okay.
Kathy Moore, Deputy Director of Public Health. Actually, the dental health statistics that she relayed is true. Prevention is the best approach. At the time when we first started the dental health program within the Public Health Department, I think it was better economic times for everybody. I believe we had 105 staff at that time. We are down to 72. Jackie, the dental health coordinator, has actually made some great strides. We have never actually used her hygienist skill, though. We've never had a dental health clinic where we provided service to the kids in the department. A lot of it was dental health education. That is still needed. We have 2 federally qualified health centers that provide dental health clinics. We have Access Health, the Community Health Project that also partner with us for health education in the community. Some of the accomplishments that the program has made has really been great. At the state level, though, with the Michigan Dental Healthy Kids, have really picked the dental health program up, and we're sort of paralleling or duplicating some of the things they're doing. We most often, for education, refer them to a lot of the state programs that's in place right now. It's not, there is no way we're saying we don't need it. We need every public health activity we can do. It was just a matter of priority. The dental health program was not a required service at the state level. The health education and nutrition education is required under the public health code. And our last accreditation, they really alluded to, we can't use the WIC program to say, yes, that's our nutrition education across the community. And so we did propose the elimination of that position and to reinstate or to fill a vacant public health educator position to actually accomplish all three of those. So that would be dental health, nutrition education, as well as general health education. What we're doing a little different is trying to form community partnerships. So we have a community partnership with Rotary for the 1 in 21. We want to be the #1 ranked in the county in 2021. A lot of that is just really trying to leverage our resources and not really have one person try to do everything. We just can't do it all. And the only way we can make some stride in Muskegon County as far as public health and dental health is to partner and spread that whole responsibility. So that is why we made that recommendation.
Yes, Kathy, you have a relationship with the healthcare communities actually in Muskegon.
Yes.
And they do have dental services, right?
Correct.
Some of those clients would also be yours, maybe?
No, we've never had actual clients. So over the 12 years of the program, we've never had actual clients. Some of the activities that Jackie did was the fluoride rinse program in some of the communities and school districts that doesn't have city or municipal water. The state also offers that program, and they work directly with the schools to provide that program, and they give the school the forms, the source of where to purchase the fluoride rinse. And so even at the state level, they're saying they want the schools to take responsibility for programs like that. Even when Jackie did it, she helped coordinate it, but the PTO or PTA, I forget what they call it, but they really ran the program. They collected the money, they watched the kids do the rinse, and then they did the recording. So it was really their program, but Jackie was available for technical assistance.
Thank you.
Any other questions?
I don't have any questions. I just wanted to comment. Kathy mentioned there are 2 FQHAs, Federal Qualified Health Associations here, both of whom provide dental services to the underprivileged. And there is a preventative component in that program, and the Dental Association in Muskegon has been very active with a program called Miles of Smiles.
Right.
And they do a lot of volunteering. Understand the concern, but there are a number of other programs, including one through Access Health, which Kathy also mentioned, that does provide excellent service.
Can I say something?
Thank you, Kathy.
Thank you.
I'll get you want to continue? I'll get back to you.
Okay.
Thank you. And just moving along to, again, the cross-section of the funds, of course, community mental health always must be addressed, given this is the largest single department we have here in the county. It's 1/3 of over every revenue and expenditure that flows through all of our transactions at the ledger. And as you can see, they're, again, moving along with their funding being in place. Their appropriation is going up a stitch. But the good thing with community mental health is for every dollar that we do invest there, they do turn over quite a bit. I think it's tenfold, if I remember right, for every dollar for you get 10 in return. I always remember John North always indicating that. I don't know if that's still always the model or true here, but I know that obviously the key is that money is well reinvested in this community. And so, as you can see from the reserve fund balance, always in place, and meets the criteria of the department. They are the good things obviously going within community mental health is this aggressive approach to fill the vacancies that have long standed in the department in an effort to make sure we're reaching out and diversifying services within the community of Muskegon. And I applaud Julia Rupp for her efforts. I think it's well received and definitely as a positive piece moving forward in this budget. Brookhaven had, everyone knows, has received some press in regards to the loan that was given to them from the previous fiscal year. Has a very optimistic budget, in which we all hope the best. And again, Martin Rosenfeld has done some very good things at this facility, period. I am happy to see that he's always looking for alternatives, for suggestions, cooperation from the county, and refining this institution to make sure it is sustainable for the future. And so, again, as we're planting that seed moving forward, we're optimistic that the facility will start to break some of the past historical trends we have seen, financially speaking. Child Care Fund, again, another one that's, I'm sorry. Yes, sir.
Just as a question, is Brookhaven meeting its obligations on the payment?
Yes, within this budget, this is the first fiscal year where they will make that, and it is within their budget.
Thank you.
You're welcome. Principal and interest. Child Care Fund, again, this is another one that's close and near to my heart as well. One, obviously for the services that it provides for our community and for our children, but two, to make sure that these escalating expenditures, which we've had from historical trends, does not continue. Because obviously, if one end breaks, the whole thing falls and collapses where we don't provide services. So, again, this is part of that collaboration effort that I mentioned prior between multiple departments within this county and state agencies to have an impact on these children's lives within this community, to invest back in this community as much as we can. And again, like I said, I can't keep reiterating this, we're already starting to see positive traction within those expenditure trends. So I am happy to see that, and of course, we'll be happier as it continues. Public Improvement Fund, as everyone has seen, is walking in this facility. The first floor is nearing completion. It will be hopefully complete here by the end of this month, we're hoping. We'll have a certificate of occupancy then. That's that project within the first and second floor is coming close to a close, and you're seeing the reserve balance that we are projecting moving into the 13th fiscal year. And so that's the reason why you're seeing, as it's drawing down, that project is coming to a close. I'm sure everyone's happy to hear that. Solid Waste Fund, again, I don't see anything here that concerns me. I see the main thing that I like to see, obviously, is that accrued closure cost balance remain at the level to where it needs to be able to cap that facility at its time. And John Warner does an outstanding job with Greg Leverage to make sure that those funds are where they need to be. And so I'm happy to report that we're right where we need to be, and it's a very healthy fund. Airport. The good news that we're seeing here again is a reduction in the general fund appropriation to the airport. And again, that's the trend we want to see. Again, as much as we can, we want to make the airport self-sustaining, and it would be perfect to get them 100% self-sustained without any general fund appropriation. We're not there yet, but however, we're getting there. Sometimes it is baby steps, but we are making some positive traction towards getting them to be self-sustaining, and I think there's a lot of good efforts going on here with your community development director, Bob Lukens. Of course, Marty Piet, as we all know, is very well engaged with these circumstances at the airport, and we're seeing some positive traction there. In case if anyone doesn't know what that CFC reserve is for the public, we take in funds for each ticket that is purchased. Goes into a reserve that the county maintains. It is not county money, however. It goes to it's a passenger facility charge that the rental car companies, as we have an agreement with, that we hold that money for, and eventually it will go towards a capital improvement of some sort, either it be a separate rental car facility at the airport or improvements at the existing facility. but that's what those monies are for. So I just want to make sure that's clear to the public that those funds, we are just the custodians of those funds until the time comes to where the funds are needed. Mats, again, Mats is coming along just fine. And again, the main thing that we like to see with Mats is one, self-sustaining, and they do have their in their budget, obviously, keeping in mind forward thinking that new terminal that's coming here in the near future. That is all that those planning efforts are well on their way. And also the main piece is to make sure that it's a self-sustaining activity, in which it is. And again, this is one activity that does not receive a general fund appropriation, and hope that continues. And actually, everything I see shows those trends continuing. Wastewater fund. Here again, you're just seeing the positive balance that they have left, and this is in their. If you take all of their retained earnings and added up, that is their fund balance they have as of now. The majority of that money sits in their own equipment revolving fund, which they have for themselves. And again, we're seeing again some stability in the rates, which everyone wants to hear in Muskegon County, I'm sure, for wastewater rates. And actually, we're in year 2 approaching of the new rate study, which that'll be. Mr. Eisenbart will be presenting that budget to the user group coming here. I think that's coming up I think it's next week, if I remember right.
20th, next Thursday.
Yeah, next Thursday. Thank you for warning. And so, again, I think you guys will be very pleased to hear that second phase that's coming up. Insurance fund. And again, as you see from the reserve balance, we're estimating what we think the balance will be. Everything looks good. Again, obviously with the employees picking up a larger share of the medical piece, obviously that does help the county balance its budget, period, it does. But also in regards to the other reserves that are funded through this, we are self-insured for everything with the exception of dental, if I remember right, and everything else from workers' compensation to unemployment insurance, to property damage and liability insurance. All of that is within this fund that covers everything from employee activities on up to liability. And so that's what this fund does. It is healthy reserves. We dive in and we do the appropriate analysis of these funds to make sure we always have the appropriate reserve balance in lieu of past historical claims. Any questions yet, or can I keep moving along? Okay. Energy Improvement Fund. Again, this is where the bonds that that was the Honeywell project. Through those Build America bonds, these were those energy savings bonds that we partaked in, and that's as you can see, we're doing just fine. We are starting to get into the payback phase of those bonds, in which we're collecting enough and monitoring those savings, those energy savings, and the other questions coming, to make sure that we have always enough historical revenues coming in, and we don't just look one year next. We're tracking well up to 23 if I remember right, and beyond, to make sure that we always have enough revenues through these energy savings to be able to pay back these bonds. Total budget, if you had to slam everything together and see what do you got, well, you got a $262 million budget that provides these services to Muskegon County residents. And what you can see, the planned use of reserves is right hovering around about 4%, which again is always happy to see from an accounting perspective that we're using very little reserve, but of course, again, these are planned reserve drawdowns. Now moving on to labor analysis, you're seeing these trends start to flip-flop in 2 different ways. You're seeing the general fund positions starting to wean down, and you're seeing CMH build up. But CMH has those funds through their different revenue sources to where, again, being able to fill those vacancies that have long been there from historical past practice, and be able to offer more variety of services to the community. And of course, any questions regarding those services, Julie Rupp is of course in the audience as well. But as you can see, otherwise everything else is relatively static, with the exception, of course, you see Brookhaven's going on a little bit. just to show you some of these new positions that are being created. This is a snapshot of them. And as in continuing, you're seeing again a lot in that mental health piece, flip back and forth between them. Again, just taking advantage of those funds that are available to community mental health. And you see there's been a little bit of a bump up in staff from Matt's perspective, and I assume that's to meet the ever-growing demand of additional services and runs and routes for Matt's. Position eliminations, as you can see through a lot of it through economies of scale to where we're consolidating down these exact same activities down to other areas within the county to be able to still offer the same support level, but just in a different way. Tax rates, again, per the publication that was put into the Muskegon Chronicle actually twice. We actually publicated beyond what our minimum criteria was. We heard the suggestion of our county clerk to make sure that we were getting into a Sunday paper as well as one of the weekly distribution. The tax rate, again, we assume no change in that operating millage rate, and then that millage rate goes towards the operation of the general fund. It's roughly around 25 million of the 43 million of the general fund that supports those activities. And as you can see, it's right at where it was from the previous year. Any questions? Concerns?
Thank you very much. You're welcome. Now, for public, anybody else would like to comment? Yeah.
Again, I have kind of a unique position because I work in Grand Rapids and I live here and I've been doing this forever. And so Miles of Smiles serves Ottawa County. My students serve on that van, they have for the last 12 years or longer. I think it's actually been quite a bit longer than that. And so they are serve Ottawa County. Access Health way back actually had a grant, and they had the Miles of Smiles program come here to Muskegon County to serve the kids in the schools. And I was on the Dental Health Coalition at that time, and I strongly advocated that those kids start going to the 2 FQHCs that we have here in Muskegon County rather than spend that $25,000 grant money to have this bus go to the schools where the kids could go to a dental home at one of those 2 FQHCs. The other thing is, I've been doing this again for a long time in Ottawa, or Kent County. We had what's called adult dental services, and we provided care to the people with lower SES or socioeconomic status. They couldn't afford dental care, and we did that on a lot higher scale than what they're doing in here in Muskegon. They've got a pilot going right now. It's very slow moving, and they don't see very many patients, so there's a lot of adults. And if you read some of this information that's on the website, if the people pay it forward first by doing some community service, and they do 8 hours of community service, or maybe 16 if they need a surgical extraction, then and only then can they have the dental work done. And so access to care for the underserved people or the disadvantaged people in Muskegon County is not where it needs to be. And so if we decide to eliminate that position, the Dental Society really needs to step up and ratchet up their service to these people because it's not where it needs to be. And I've known that because I've been doing this for, again, 38 years now. And this is, yes, and also about the 2 FQHCs. Way back in 1991 when I was dental program director at Grand Rapids Community College, I got a call from Julie Johnson, who ran Head Start at that time, and she said, Deb, she said, we have no dentists in Muskegon County that will see Head Start kids. Can you do the exam so they can start school? So I said, sure, Julie, pack them on the bus and come on over and we'll do those exams. And we did. And we did 2 bus loads of children so they could start Head Start that fall. Well, that kind of speared the dental community to then jump on board and start doing something about the fact that these kids, these Medicaid kids, were not being seen. And now that Jackie, because of her connections with everything around the state, has really been instrumental in pushing forward this My Child Dental, so that the dentists are actually getting reimbursed at a higher rate. We're seeing more and more of those kids out in the dental offices, but they need to do the same thing about adults. Something needs to happen. As a landlord, for 36 years. I see a lot of people that end up not being able to go to work because they have dental pain, and they have absolutely no place to go. And so that's just not acceptable. We need to work on that more. So hopefully, like they did to institute those 2 new FQHCs to meet the needs of those children because the dentist didn't see those kids, they need to do something about the adult population also, and not move it slow. If they were the person in dental pain, they would not want it to, take 10 years or 16 hours of community service to have 1 extraction done. So they need to do something else. And I see in Grand Rapids what some of them have done, and I see the successful Miles to Smiles program in Ottawa County. I'd really like to see more of that here. And if you call the 2 FQHCs, most of the time they're not accepting new patients because they're full. But then on the other hand, their schedules are not full. And so I don't know where the disconnect is. But if we're going to eliminate that position, things need to work a little better for those people that can't receive care. So thank you for your time.
Thank you.
Move we close.
All right.
Heath, could you go back to that slide where it did the position elimination slide? Just want to take a quick look at it. Thank you.
Anybody else?
Move we close the public hearing, go back to the regular session.
You have one here.
Step to the microphone, Shine.
Shani Tate from NAMI Muskegonshire. We are a grassroots nonprofit 501c3 from based out of Lansing, Michigan right now. But we also have a small resource center library in the mental health center. We have been told that we have to move our resource center out of the mental health center into a new building or into a new space. I don't know if it's because of cuts, I don't know if it's because of what the reasons are exactly, but the space needs to be used for other needs or reasons, which I understand. What I'm in need of is another piece of space, because our resources in our library for what we do, NAMI is the National Alliance on Mental Illness, is for outreach and education for community members, and it is exactly what these cuts are for, or for what we do is outreach to people who are in need of mental health services that may be turned away from the people that come into mental health that can't receive the services, or who or may be referred to other organizations because they have insurance or because they don't meet the requirements of mental health services. There aren't many other places that they can go. So what we are asking or looking for is another place to be relocated to, if anyone has any ideas, because we are not self-sustaining yet as of this point. But if anyone has any ideas, please feel free to contact me or anyone at Mental Health, because it's an important resource for the public and the community, and it's something that we don't want to see go to waste. Thanks.
Thank you. Anybody else?
We go back and close the public hearing, go back to the regular session.
I'm moving second, go back in the regular board meeting. All in favor, say yes.
Yes.
Opposed, say no. Back in regular session. Next item on the agenda, WM 12/09-117.
So moved.
Second. Motion been made and seconded. Questions on the motion? Seeing none, all in favor say yes.
Yes.
Opposed say no. Motion carries. Next item, WM 12/09-118. Adopt a resolution accepting the funds from the Michigan.
So moved.
Second. Motion's been made and seconded. Questions, Mr. K?
Yeah, could you see, we're spending so much money on this park and everything. I'm more curious, something have you an answer, but could you see what we're gonna end up having to charge like for parking and things like that, like the other parks are doing? And
Judy Kell, grant coordinator. Under the grant agreement with the Michigan Department of Natural Resources, we are not able to charge any fees for parking or entrance.
so all the maintenance on this will forever come from the county.
Correct. But we're trying, now listen, we're trying with the all-inclusive playground. Hopefully, we're going to have enough stuff underneath it that will not require grass cutting. With the Ice Mountain grant, we're putting in all of this habitat restoration, so that won't require any grass cutting. United Way tomorrow is going to be working on some of the area and getting rid of the invasive species, and then we'll spray it so we can get rid of that. So as we're building this park, and it will be a nice park, we're doing it with the intention of making it as least expensive as possible for maintenance. We're putting everything into that effort to do it.
Well, like Heritage Landings, where we charge for some of that stuff, will that, because, I mean, I hate to see parks like in Flint Lake have their rates go up in order to pay for a park somewhere else.
This is part of Heritage Landings, so.
So their rates shouldn't keep up to all this.
Correct.
Yeah, Commissioner Zierzynski?
Reading this, what a wonderful piece of fitting things together for this community. I congratulate you, Judy.
Thank you.
The all-inclusive park is the one behind the Y, correct?
Yes, sir.
Okay.
Right, right where the water is, and then we're going to have that nice landing there, and that landing will be used purposely for not only able-bodied but disabled individuals to enter the water with kayaking and canoes. And the all-inclusive playground equipment will be include all kinds of equipments for the blind, the deaf, and the disabled. So this is a very exciting project.
Thank you.
Go ahead.
I'd like to comment that we have taken a piece of county land at the north that was there and had been sitting there for a lot of years, and turned it into revenue that went to acquire this property to make an addition to Heritage Landing. And that park has been funded and will be funded and expanded without any real base for taxpayer money. So it's a win-win, because the parcel of property that was disposed of up north is now a part of the Muskegon Museum complex, and all of that came about because of county involvement.
And tomorrow, if you would like to volunteer, we still need volunteers with chainsaws and loppers, and we'd be happy to have you come out there and start trimming.
I might add to it, took an eyesore, staking an eyesore out of there, that'd be something beautiful. I mean, and that just complements Heritage Landing. It's a great thing.
Congratulations.
And we do need to thank the Rotary Club of Muskegon, and Mr. Nolan is here from the Rotary Club for providing the match.
We'd like to hear from Mr. Nolan.
Yeah, if you could step to the roster, Mr. Nolan, please.
John Noling, past president of Muskegon Rotary.
Just give your involvement in.
Well, I'm impressed with your leadership here at the county. Working with Judy, our club has committed $200,000 to help you purchase the property, and we're backstopping another $90,000 by applying for grants to make the match possible that's up on this screen with the Natural Resources Trust Fund. Of the $90,000 that we've sought as a club to raise, we are at about $67,000 right now, and we're very confident that by October we'll, through our applications to the final 2 foundations that we're asking, we are confident we'll be reaching our 90,000. In any case, that 90,000 match allows the 160, I believe it is, Judy, from the Natural Resources Trust Fund to come together for a giant sum of money that will allow us to start putting bids out to get the drawings done, and possibly construction, as Judy informs me, could begin after thaw, winter thaw, and looking ahead, possible May 30th or thereabouts dedication with the Rotary Club and the county working together, and our foundations to be represented as well, those who've contributed. Alcoa has been very supportive. The Community Foundation for Muskegon County has been very supportive. Disability Connection here in Muskegon has been very supportive. The Gerber Foundation has already given us money, and we're currently applying to Consumers Energy and DTE foundations. So, as a club, looking back at the first proposal for this park 5 years ago, it's been a lot of work and a lot of meetings, but you know what? When it's all said and done, and we have a park that extends the value of Heritage Landing, which is a classic lakefront park for our town, to have a playground and a kayak and canoe landing and picnic areas for adults who can bring their children and their families right down to Muskegon Lake shoreline, right between the Y and the big white tent. I think it just adds value to what we have, and I'm pleased as a member of the Rotary Club to work with the county officials, and especially this lady right here. It's been, we're watching it unfold, and we're pleased with the direction.
Great job. Great job.
Thank you.
Team leader for tomorrow morning, so he'll be out there with lockers.
Thank you very much. Any other questions? Seeing none, all in favor say yes.
Yes.
Opposed say no. Motion carries. Next item, WM 12/09-119.
So moved. Second.
Motion's been made and seconded. Questions on the motion? Commissioner Derazinski.
No.
Oh, you had your hand up. Okay.
Do we run any kind of comparison with the state parks and the private sector parks to see if, money-wise for camping and all that, to get these fees?
John Warner, Public Works Department. Yeah, we always do compare ourselves with state parks, and typically we are always at or below what the state park is charging.
On the private sector, do we look at that at all? Because I mean, I'd hate to see we're way under them or anything like that, so.
We're about half the price of what the private sector is.
You're half the price.
Yeah.
What doesn't?
Or a little more than half the price. Private sector is between $30 and $40 a night.
Then I kind of worry about like if we're hurting the private sector, so.
No, I don't
going up higher.
The private sector offers different types of amenities at their parks than we do. And we don't have the money to put those kind of amenities in, so we can't charge the kind of rates that they can command.
Any other questions? Seeing none, all in favor say yes.
Yes.
Opposed say no. Motion carries. Is there any old business? Anybody have any old business? Any new business? I have, I'd like to call for a special human resources meeting on September 13th to adopt changes to the board policy. If I can get a motion on that.
So moved. Second.
Motion's been made and seconded. Questions on the motion?
If I may, I surely hope we have copies way ahead of time.
I'll have them out tomorrow.
Okay, I haven't
I'll email
seen
them to
that.
everybody
Okay.
tomorrow.
Anybody else? Any questions on it? All in favor say yes.
Yes.
Opposed say no. Motion carries for a special meeting on September 13th, human resource meeting on September 13th. Now comes time for public comment on a new topic. Would anybody like to speak? Hughes.
Susie Hughes, I'd just like to say that the thing that my mind just did, the thing that they did for the parks that Judy wrote up, I thought that was very nicely presented with every little thing on it, so that it explained all the way through who all participated in it, how each amount came out. So it was really easy for me, at least, to understand how that all came through. It was really nicely presented instead of just saying, I'd like to approve this. I really appreciated letting everybody know where all the money came from and all the different work that went into making the park work. So I appreciate how that was presented on that. Thank you, that's all.
Any other public comment?
Just a quick reminder that on September 20th, we will be meeting in Whitehall Township.
Oh, and I'm not done.
Oh.
Again, Saturday is Youth Day out at the fairgrounds. If you've got kids or if you've got grandkids, please bring them out there. It is a fabulously fun day for kids. This is our 17th year, and anything in the outdoors that a kid could enjoy, we have out there for them for free. We've free lunch, free prizes, and this is something that is all for the kids. There are a lot of organizations, and nobody sells a raffle ticket, nobody sells a membership, nobody promotes themselves. It's all about the kids. It's out at the fairgrounds. We start at 9 o'clock in the morning, we go to 3, and we provide lunch for the kids. So it's free for everybody. It's just fabulous. So if you got kids or grandkids or can borrow somebody's kids, please bring them out. It's so much fun.
Thank you. One other thing, like Judy said, tomorrow's Community Day carrying at Rotary Park and at Wesley Park in Muskegon Township.
And if I may, on Saturday, I have a dive club picking up the bottom of Wolf Lake again. We've been doing that every 10 years, and it's a very successful program. You'd be amazed how much comes off any of these lakes. Starting at 11.
There's also on Saturday, there's a Disability Connection, CAC, Consumer Advisory Committee picnic for Disability Connection. It's for a fundraiser that we're doing for prizes, drawings, eats, and grill.